again, if you'll just remind us, what brought you to see me? Kind of what was the chief complaint that you wanted to come talk to us about in the first place?
So I've always had naturally hooded eyelids, and also genetically, my parents both have hooded eyelids. And so as I've gotten a little bit older, they've just continued to, the skin has continued to sag a little bit more, a little looser, and Botox can only correct so much. So I was referred to your office and came in for a consultation, figured out an upper bleph was probably the best thing for me. So found out that that was a great opportunity, and so came in for an upper bleph, essentially.
Yeah, and so upper bleph, that's a phrase we toss around a lot. Blepharoplasty is a big doctor word. But what did you end up having done? What, when you and I met, we decided, what was it that we did?
So we wanted to take excess skin off the eyelid just to remove the hooded look. Yeah. So it's not so much heavy on the eyelids. It kind of almost was impairing vision a little bit. I felt heaviness, especially when I was getting more tired throughout the day. So we decided to take excess skin off and remove that. So now I have more open eyelids. I don't have as much skin weighing down, and it feels a lot more open and refreshing.
Were you a little bit nervous? How did things go the day of?
Yeah, so I did get prescribed medication beforehand. So I was able to take something for anxiety if I were to have any. I really didn't wake up too anxious just because I've done a lot of research and I understood what was, you made it very clear about what the procedure was going to be and how quick it was going to be and the timing. Of course, you get a little nervous initially, especially when you're sitting in the chair and ready to go, but everything was really straightforward, didn't feel a thing, didn't really have anxiety after I took the medication. And so came in, took about an hour total, I think it was, maybe. And I was out of here and good to go. Got a coffee.
Yeah, that's
you sent me home with a coffee.
Tell us a little bit about the immediate post-op. So like you said, we did your upper eyelid surgery here in the office. You of course took a medicine to make you a little relaxed. We did use numbing medicine. We use cool compresses as soon as the surgery's over. Because you take a medicine to help you be a little bit relaxed. You have a driver, of course. Yes, so I think it was your dad that was here. I remember meeting your dad. It was fun to meet your dad. But then tell us then, after surgery that day, just tell us a little bit about first, immediate post-op, first 48 hours or so.
Yeah, so got picked, my dad was here to pick me up. We went home. He dropped me off, and honestly, it wasn't bad. Got home, just was able to hang out. Watched a lot of movies, honestly. I'm a contact wearer, so couldn't wear contacts, obviously. There's a little bit of swelling, but really the first day wasn't bad. Waking up the next day, of course, there's going to be some swelling, but zero pain at all. I was not feeling anything, didn't have any discomfort.
Did you take a pain pill?
No, didn't have to take any pain medication. You probably
remember I prescribe a pain pill.
Yes, yeah.
But then I also try to talk to people about not using it.
Yeah.
And all I mean by that is, also Tylenol and ibuprofen are available. And so I always try to get people to start with Tylenol and ibuprofen, but, I've prescribed something. And so then, just like you've explained, you have it available, but you didn't take a single pain pill, is that what you said?
Not even Tylenol.
Okay.
I really didn't have any discomfort or pain. Just more of the swelling. So the only thing that really was more on the discomfort level is just the vision. So, just the swelling and not having full vision at first because of the swelling, but zero pain.
Cool. Okay.
Yeah, the first week was pretty similar. The swelling would really get better and better each day. Minimal bruising. I did take arnica supplements, so that helps with bruising. And I think it's actually supposed to help with pain. It's just a natural supplement. So that was great. Minimal bruising. So just the week just took time to heal a little bit, but very easy process. Got better each day. Came in for the post-op week appointment. Looked great. Was very happy with the results so far.
Good. Yeah, I remember We were just looking at your 1 week post-ops a second ago and kind of remarking about how little bruising there was. You were like, well, there's bruising in that photo, but
Yeah.
I think people will be really kind of amazed at how little bruising there was at 1 week.
Yeah, my friends are definitely impressed too. They were shocked that it was such a drastic difference from before and after only 1 week. So that was great.
Right. Well, and now you're 2 weeks, and even that little bit of bruising's pretty gone.
Yeah, I don't see any bruising at all, honestly.
Right.
And very minimal swelling.
And the bruising that we did see was kind of just here in the lower eyelids. You know, I think a lot of people are sometimes surprised that if I do a brow lift or an upper eyelid surgery, swelling ends up down here in the cheeks pretty quickly. And we know that's very normal. And some of the things that I would have told you or said to you about bruising and swelling, you know, bruising and swelling, you just said it, but it kind of increases those first couple of days, then it just sits still for a couple of days, and not till about day 4 or 5 does it actually start to go away.
Right.
So a lot of times people will come in at 1 week and we'll expect them to have some bruising and swelling left because it's not been going away that long yet. Today, you're 2 weeks out. What would you say just towards just overall results so far?
Very happy with the results. There's still a little bit of minimal scarring.
Right.
We talked about that.
Right, we've been talking about that today.
I did get scarred cream here.
Silicone,
yes,
or scar gel.
So I've been using that twice a day.
Yeah.
And so far I'm seeing, you know, that gradually fade out a little bit. And so most of the swelling seems to be down. But so far very happy with the results. I have eyelids now, which is something that I've never had before, which, you know, is exciting.
Yeah, I'm excited about your before and afters. I think, like I told you, you look at the before picture, and this is a young, pretty lady, and she just so happens to have, like you just said it yourself, sort of this familial fullness or loose skin of the upper eyelids. And again, in review, we've done an upper eyelid surgery. We're 2 weeks out, and the after picture at the 1 week and the after pictures we just took again today look really nice. So.
Yeah.
Just want to share on the overall experience so far.
Yeah, I mean, everybody's, you know, experience would be different, but personally, I took off 2 days off work, and I really didn't need to do that. I could have worked in front of a computer if I really needed to, but I did.
Which I probably told you don't do.
You recommended, you recommended me taking time off, but really it was easy for me. I didn't have as much of the swelling and the bruising that I thought I might have, so it was a very easy surgery. The procedure was easy, the healing was easy, no pain. So I highly recommend it. I know I have friends that are looking into it as well, so I highly recommend it. I would do it again. Very easy. Right.
Thanks so much for coming to see us, but thanks also for doing this interview.
You're welcome. Thank you for having me.